Before jumping into the cockpit, let's understand how hypoxia can sneak up on us last second. Pilots don't fail from a lack of skill, they fail from a lack of oxygen. Here's a 60-second checklist. Hypoxia is due to not enough usable oxygen in our tissues. There are 4 types of hypoxia. Hypoxic hypoxia is when there's not enough oxygen going to our lungs. This is very common with altitude. Hypemic hypoxia is when our blood can't carry oxygen. Think carbon monoxide poisoning or anemia. Fatting hypoxia is due to poor blood cell circulation. Think cold temperatures or excessive G. Toxic hypoxia is when our cells can't use oxygen. Think of when alcohol or drugs. These are the oxygen rules and requirements that you're required to know per FAR AIM 91.211. Between 12,500 and up to including 14,000 feet MSL, you as a pilot are required to have oxygen after 30 minutes of flight. Above 14,000 feet MSL, minimum flight crew is required to have oxygen. Above 15,000 feet MSL, all occupants are required to be provided oxygen. Keyword provided, but the minimum flight crew is still required to use oxygen. Above flight level 250, you need to be able to carry an extra 10 minutes of supply per occupant. Above flight level 350, main pilot needs to be on the mast that continuously or automatically supplies oxygen. However, it is recommended that during the day above 10,000 feet to have supplemental oxygen, and during the nighttime to have supplemental oxygen above 5,000 feet. Your time of useful consciousness shrinks fast as you climb, so don't wait for these symptoms to sneak up on you. Watch out for euphoria, cyanosis, delayed reactions, bad judgment, poor vision, feeling of drowsiness or dizziness. To prevent hypoxia and to treat it, you need to descend down to a lower altitude and use supplemental oxygen now. Hyperventilation is when you're breathing too fast, resulting in low carbon dioxide in your body. Hyperventilation is similar to hypoxia, but the fix is a little different. To prevent hyperventilation, we need to slow down our breathing, talk out loudly, or breathe into a paper bag. Know the 4 H's, know the oxygen rules, and you'll keep your brain online. Follow and save this and grab the private pilot study guide in my bio.